Welcome to Bite Size Conversations. We have, I think there's 20 of you here today. So we're doing a little bit different with videotaping it this time. If you do not know, you can go out to the Astera Health YouTube and watch the videos. How many of you have done that? Quite a few have. All of them are out there. In the past year and a half, I think, that we've been doing these, so you can go back and watch anything that maybe you have missed. So I got some comments on lunch today. What did you think about those salads?
Very good.
You liked that?
Yeah.
That was perfect?
It was perfect.
Sandwiches are better.
Well noted.
Did you say sandwiches?
Chocolate.
A little piece of chocolate.
A little piece of chocolate. Okay. Noted.
So cute.
Well, we have Richie here today, and I was going to interview him and kind of get some things about him, and it's like, why? He could tell us a little bit about himself.
A little bit, yeah, sure.
Yeah, so welcome.
Welcome. Thank you, Kim. So as she said, my name is Richie. I'm one of the community paramedics here at Astera Health. I'm the community paramedic coordinator. We have 4, as you'll find out when we do a presentation here, community paramedics. Unfortunately, they're busy doing other things. 2 of them are on the ambulance. One of them is Tom in the back of the room there. He's our education coordinator, and then myself. But we do a few things, and we're going to find out. I had a little game where we were playing. Some of you were here, some of you were not here. Where we're talking about professions that a lot of people don't know what they are. For instance, how about a fuller? Anybody know what a fuller is? A fuller. A fuller is someone who shrinks and thickens wool. That's the name of that profession. And here's the last one, eggler. Anybody know what an eggler is? It's an egg seller, right? Eggler, egg seller. All right. The reason I wanted to play that little bit of a game was because a lot of people don't know what a community paramedic is. They have no idea what a community, they might know what a medic is, they know what a community is, but what is a community paramedic? And that's what we're going to talk about today, the role that we have to be able to help you. Now, we know you call 911 when you're having emergencies. Paramedics show up, ambulance shows up. What is a community paramedic? We're going to talk about that. We'll learn a little bit together today and how we can help you. Let's hit the space bar and see if that works, and that doesn't work. All right, so let's try something else here. There it goes. Oh, and then that's me. The reason that's up there, just to give you a little bit of background, I've been in emergency medical services for 31 years. I've been an EMT since 1994, was a firefighter paramedic in Colorado Springs, Colorado from 1995 to 2016. Lots of experience. When they pulled the numbers, when I left there, it was almost 20,000 alarms that I've been on in 21 years. Downtown Colorado Springs, very busy. Military town, lots of things there. So we moved here. I moved here to a small little town to help take care of my folks. From 500,000 people in the county to population of 600 in Verndale. So what a change. But I got a good night's sleep the first night I stayed here. So, and come to find out, I still hear gunshots, but they're in November when people are sighting their guns. So that's okay. So that's me. And I think my cat walked across the keyboard. No, I'm just kidding. National Registry EMT paramedic and community paramedic. So it's just a certification. They like to see those things up there. When you talk to your doctor, they'll say MD and all some of the. They just like to see that up there to give you a little bit of credibility. But just trying to be a good guy and help everybody out. All right. So I think I'm going to have to go and hit them here.
Yep.
Okay. So no space bar. Okay, so let's talk a little bit about the history of community paramedicine. Anybody ever been to New Mexico? No? A couple people, right? It's beautiful. Taos, New Mexico, that area there, it's beautiful. Well, here's the history of community paramedicine. A little town right there called Red River. Here's some of the demographics, about 20 miles south of the Colorado state line, 38 miles northeast of Taos, New Mexico. the ski valley there. And there's some of the demographics there. Seasonal tourism is what really supports it. And you can see almost 10% below the poverty line. So here's this fire department called Red River Fire Department, and they identified a need. They had a need because there's only about 500 people during the off season, but all of a sudden it swells up to 10,000 people with the ski tourism and the ski resort there. And in 1993, they started looking at the fact that there weren't enough doctors. There weren't enough people to take care of people. The nearest hospital is 38 miles through some winding canyon roads, icy. It takes over an hour just to get to medical care if you need it. Physically, basically no medical care. There were no pharmacies, no dentists, no place to really get any kind of care there in the town. And again, fluctuating between 500 and 10,000. And the fire department was transporting 200 to 300 people a year. Small department, lots of need, and who's covering? When the ambulance is transporting somebody an hour and a half, an hour away, who's covering when somebody else has an emergency? We still kind of have the same situation in our area too. So it's something to think about, but we're talking about 1993. And so what happened? The state of New Mexico in 1995 set something up called the Senate Joint Memorial, and they studied what would happen if we expanded the role of EMS. What happens if we have paramedics maybe help out a little bit? Because there's no providers, there's no doctors, nurses. What can we do? And how would it impact the community? Well, this was the mission. They wanted to see how they could help better the community, how they can help with disease processes before they get going really bad. Sometimes people were calling 911 after 2 or 3 or 4 or 5 months of having really bad issues. How can we get the community to reach out? How can the paramedics, how could somebody reach out and help them early on in the process so it doesn't get worse? How can we reduce the unnecessary trips and transports to the hospital? People calling 911 because they have a toothache. A lot of people don't realize there's no dentist on staff, and even in major hospitals. The only way a dentist will come to a hospital, a major hospital, is if there's a trauma and there's some massive type of damage done to the mouth. People maybe that had a foot ache or a headache for weeks, and they're calling the ambulance to come and take them after they've had it for 3 or 4 weeks, but they had nobody to go to. This is 1995, okay? How to be cost effective and reduce the cost, because this costs money. Taxpayers, you have to keep thinking about that. And then using EMTs. It was a large workforce in that river area. So again, this is 1995. Just giving you a little history. 5 paramedics went through this course. They had 380 additional hours on top of their paramedic hours that they were already paramedics, 600 clinical hours of training, and it developed a scope of practice so that we could do some other things other than just regular paramedics. We started working with the community to help them have a maintenance program, maybe some visits, some regular visits, and referral for triage. And what that means is paramedics were able to see if they really needed an ambulance or not. And that way, only the community paramedic was going to visit. If they needed it, they would call the ambulance. If they didn't need it, they could make some decisions there. A medical director approved 76 protocols, 76 new procedures those paramedics could do, community paramedics could do. And that included just some chronic care for people who are having some issues like COPD, CHF, diabetes, chronic illnesses, and even family planning, believe it or not. Well, what happened? They got some training on histories, how to take better physical examinations, do some more in-depth type of care with the patients. Some wound care and suturing, believe it or not, as a community paramedic, it's in our scope to actually put some small sutures. Somebody has a little cut, why call an ambulance to take you all the way to the hospital? Again, this is 1995. So the paramedics were trained to actually put some sutures, take them off, so to do some additional treatments, and also to, again, figure out if you really needed an ambulance or not. Well, what happened? That oversight reviewed all those reports, and after 3,344 cases, they found out that very few people were calling because they needed a doctor. Here's what that meant. The reason they figured that out is because what was happening is people needed medications, and people needed prescriptions, and those things paramedics can't do. So people were actually driving to Taos and driving themselves to get those medications. So what happened is that in that portion of it, as far as primary care, it didn't really have an effect. But where it did have a value to the community is something that is very, very vital, and that is ambulance transports that were unnecessary were reduced from 78 to 11%. And what does that mean? Well, think about that. Now the fire department can stay in their area and be ready to help for an emergency. Before, that ambulance had to be gone, taking somebody an hour and a half because they had foot pain for 3 weeks. And let's say you're having a heart attack or chest pain, you had to wait. Now that ambulance could stay there. And this, again, this is 1995, but folks, we're still seeing that here because we only have 2 ambulances right now in this area. And if one ambulance is gone on a transfer, taking somebody from here to Fargo, now there's 1 ambulance left. And let's say somebody falls and hurts themselves. Well, that ambulance is gone. Who's covering? You may have to wait. We have a little bit of a solution with that, with community paramedics and with EMS education and the EMS manager. We're all medics, and we have a 3rd ambulance. But what if that 3rd ambulance is gone? Then we have some help from the outlying communities, maybe a basic life support, maybe an ambulance from Perm that has a paramedic, but you'll also have to wait a little bit. But see how important it was to keep that fire department, that ambulance with a paramedic right in the community. And it dropped it. I mean, that's significant, from 78 to 11% in just a couple of years. So we learned a lot. And over the years, that concept of community medicine has changed. It does still help with this. And I'll give you a case in point. In my fire district, when I was in the fire department in Colorado Springs, we had a gentleman call 911 in 10 months. And I say 10 months. He was a homeless gentleman. 10 months because in those 2 months out of that year, he was actually in jail for aggressive panhandling. So in 10 months, he called 911 344 times. So here's the fire engine with a paramedic going to take care of this person who is a chronic 911 caller. Do the math. Sometimes it was 3 times a day he would call. So who's covering that area? And so community paramedics. Colorado Springs now has something called CERT, Community Emergency Response Teams. And even the homeless have their protocols. And so when they call from a payphone or they call 911 and they recognize or they give them, they say who they are, they'll go over there and take care of the situation. And that ambulance or that fire engine can stay in station ready to serve somebody else. So you see where that help comes in? It's evolved. History here at Astera Health. That was New Mexico. That was where it started almost 30 years ago. How did we start? Well, in 2012, the old Tri-County Hospital, the Legacy Hospital, there was an initiative. And the first 3 paramedics, you might recognize some of those names, Sharon Hyden, Julie Jensen, and Mike Ittner, were the first paramedics that were designated as community paramedics and actually took that training and became paramedics. Between the years 2012 and 16, other paramedics became certified. Tom in the back there became a community paramedic, and there's a few others that are still here on the job that are became certified from at that time. Then in 2016, Chris Hammer, who's now a flight medic and a manager at some flight, I think DL, is that right, Tom? He's a flight manager at DL. And then Renee Miller became instrumental in shaping the community paramedic as you see it now. And it became so good that the way they worked it and the way they actually started implementing it here in Astera, Tri-County at the time, that they actually dedicated a full-time employee at part-time, 24 hours, just a week, just to work community paramedicine. They worked the program, they worked the system, they actually set it up to pretty much the way it is now. They even were able to manage a grant to get a little community paramedic vehicle. We have a bigger one now. The one we had before was nice, but you could only use it about 4 months out of the year because it was a little vehicle. Very low, hard to get into. Most of us kept hitting our heads just getting into it. It was called the clown car, the community clown car, right? It was a beautiful vehicle for the time, but it was not 4-wheel drive. And so we were able to trade it in and work with it. And we actually have a nice little Ford Explorer with all-wheel drive, and it got heated seats in it now because it wasn't for me. It was because the patient said, I'm really kind of cold. So I had to have it, right? And then in 2018, the program was awarded actually a dedicated primary community paramedic and coordinator, and that's myself, your servant here. And then prior to 2017, just looking at some numbers, right before I took over, I think we had 89 community paramedic visits in that whole year. And then we peaked with 800 in the 2022. Why? COVID. We were doing COVID inoculations, vaccinations. We were doing COVID tests prior to surgery. You have to have COVID tests before. So we were very, very busy. And I say we. I'm still tired, if you can. But we peaked. But now let's look at some other numbers. And we will, after we talk about a little bit of the role here. 30 years ago, it was thought about something to improve the quality of the rural EMS experience. But now it has become something more. In fact, Hennepin County, bigger cities, New York, Los Angeles, Denver, Colorado Springs, they all are developing. In fact, around us, we were one of the first hospitals to actually have community paramedicine. We're a model. A lot of the departments around us, a lot of the hospitals around us have called us, have actually written along with us to see how we do it, and actually developed their own programs now. Lakewood, Perham, and some of the other hospitals. We talk about it, and we call each other up, and we help each other out to see how best we can serve the community. We work closely with social services, with the health coaches you speak with, sometimes when the nurses call you, with the providers and the nurses. So they call us, they have a need, you have a need, and we do the best we can to help. We still have the same goals. Some of these things have changed, but we still have the same goals, okay? We're trying to decrease the number of unnecessary EMS calling an ambulance, and I'm sure you can appreciate that. We don't mind helping, even the ambulance doesn't mind helping, but sometimes we have to look at the priority. And really, emergency medical services, we have to be there ready to respond for something really major. And I'm sure you could agree that to go and help somebody that maybe did not need that emergency is not a good use of the resource. So what happens? They send me, because I'm not there as an emergency person per se, even though I am a paramedic. They send me. We focus on the efficient uses of resources, which is what we're talking about. We don't want to take an ambulance that costs a lot of money to run, uses a lot of gas, 3 miles per gallon, to go 40 miles away to maybe change an oxygen tank for somebody, versus me, my little car, going over there and having a nice little visit, okay, and doing a nice little medical assessment on you and talking to you and having a nice little chat. And then guess what? When I leave after my visit, I write a little report for the doctor. They're doing okay. I even ask you, is there anything you want the doctor to know? Because when I get back, they're going to read my report. And maybe you are in between visits, and maybe something's changed. And I'll put a little flag to him. I'll say, hey, they're having headaches now, or maybe this medication is making them a little itchy. Maybe they're starting to develop an allergy or something like that. They'll see that. It's kind of like a little visit. Okay? And we help fill the gaps in the healthcare system. I just threw that up there. 2001 is when community paramedics and community paramedicine started to be used, those terms, for those of you who like history. Think of us as reverse 911. You call 911 when you're having a problem that you couldn't solve, right? You're having an emergency, something serious, you call 911. We're reverse. You're going to get a call from me. The doctor says, hey, my patient's having some problems with this. Can you see them? I'll call you and I'll schedule a visit. Hey, this is Richie with the Community Paramedic program at Astera Health. When would you like me to come by? The doctor wants me to check your blood pressure. The doctor wants me to do this. When can I come by? We'll schedule that. I come over there and we do it. You didn't have to come to the hospital. I came to you. The hospital came to you. Remember, just a few years ago, some of you will probably remember this, doctors used to make house calls, right? They used to come, right, do house calls. I remember one of my good friends a long time ago. He was an old country doctor. And one of the things he got was a couple chickens after delivering a baby. Came home with 2 chickens, and at least they were hens, so they could lay eggs. Gift that keeps on giving, right? But that was the payment. It's house calls. Okay. We do in-home medical assessments. We get your vitals, set your blood sugar, your oxygen levels, do a little bit of a cursory, brief medical assessment. Nothing too intrusive. We check your medications to make sure you have your medicines. We'll help you with disorder. Home safety assessment, injury prevention. We give you recommendations. In fact, we have a new form that we use, and you get to keep a copy of it. It's not punitive. You're not going to get a fine or a ticket. It's just suggestions, maybe some things that maybe you haven't thought about, maybe even something to show your landlord or whoever you're renting from, or maybe somebody who does things in your house to help you. Might be that we suggest you put some grab bars in the bathroom, and we'll document it for you. Lab draws. Nothing like not feeling good and having to come to the hospital and maybe waiting a few minutes in a room full of people that maybe are not really healthy just to get a blood draw. I can go get it for you. If the doctor needs me to go get it for you, I'll do it. Okay? Maybe the weather's not well. Maybe you're not feeling good and you need that INR or you need that check. I can go get that for you. Specimen collection, the same thing. Okay? Wound care and stitch removal, sometimes to come into the hospital for a little stitch or two. The doctor wants me to do it, I'll go do it. Vaccinations, immunizations. Now, some of these services are kind of nice to get it done at home, but sometimes the doctor wants you to come into the hospital because he needs to see you and talk to you and do a few other things. But if he needs me to give you a shot, I can do that too. Medication administration, the same thing. If he wants me to give you some medicines, I can do that too. And any procedures like G tubes, gastric tubes, sometimes people need feeding tubes changed because of surgery they have had under colon, things like that. I can change those tubes. And again, patient comfort. 3 o'clock in the morning, ambulance picks you up, you're in your robe, your nightgown, bad emergency, maybe you forgot your glasses, your teeth, your hearing aids, clothes. I've gone to pick up clothes. Snowstorm the next day, and all they had was a t-shirt and a jacket and a pair of pants. I'll go get the clothes. Those are nice little things I'll go do. Because again, it's for patient comfort and it's part of the service here at Astera Health. We help with all kinds of things, education and sometimes just to explain a few things. Sometimes we take things for granted. A doctor might tell you, hey, check your blood pressure. Does anybody know what a blood pressure is? Do you know what those numbers mean? Oh, it's 180 over 120. What does that mean? You'd be surprised how many folks just don't understand what some of these terms that sometimes get taken for granted. A medical professional might tell you something and you may not understand it. I'll clarify it for you. I'll help you. By the way, that number just means a high number means when your heart's squeezing. The low number is when your heart's relaxed to fill with blood. 120 over 80, 120 over 80. Okay? And bottom line is we're just an extension of provider care. We just want to help you. Okay? I want folks to understand that we are just, the doctors care about you enough to send me out there to your house and to help you. Okay? We want to make sure that you're doing well. You had a procedure, you maybe had not feeling well, you maybe had a hospital, you were in the hospital for a few days. Why not make sure you're at home comfortable, okay, resting comfortably? Okay. The future. Well, our office is at the legacy old MRI room at the old campus at the old Tri-County, right next to the emergency department over there. The office currently has just me Monday, Tuesday, Thursday, and Friday. I don't work Wednesdays because I'm caring for parents, and so that's those are the hours, 8 to 4. Last year we made 498 visits, and to put it in context, the ambulance had 2,347 calls. So if you add those together, we're kind of busy. The area, the community is very busy, and we're covering several hundred square miles. So could you see how community paramedicine can help clear up an ambulance not to be used for some of these situations? Now the cancer center is going to open up in July, right? That's still on, Jackie, correct? July. Outstanding. It's a beautiful building. You can see it from the outside. Can't wait to have the grand opening. Unfortunately, we have to build cancer centers because it's a really bad disease, correct? And it affects everybody. if not you, somebody you know. And so how nice it would be for us to know that with this increase in care, to have a community paramedic on a day where you don't feel good, maybe your family member or yourself are getting some treatments, to get up, get dressed, your immune system's already maybe compromised, and to maybe sit in the waiting room for a lab draw or to get a shot of something, vitamin B12 or something like that. I can come out to the house. Done it before. I've taken blood samples from patients that are still laying in bed, resting. But what a nice thing. You don't have to get up and go to do those things. We'll be able to do that with the cancer center under the direction of the doctors there, and possibly looking at medication administration. There's all kinds of things in the future for this. So, Jackie, anything else that you can add to the,
I don't have anything specific other than.
or did I cover it? Or did I cover it?
I think you pretty much covered, but I think just that focus on how much collaboration that you or whoever's community paramedic is now having, how much that is.
Absolutely.
I think how much that's going to continue to evolve with
So Jackie just said that our collaboration with the providers in the summer when the cancer center opens up, it's going to completely increase. It's going to get even stronger to be able to extend that care to everyone who needs that care, especially those who are so compromised by this debilitating disease. But we're going to do our very best to help out. Yes, ma'am.
Are your services covered by our insurance, or how does that work?
Good question. Are our services covered by insurance? Right now, there's no charge. Doesn't mean you need to run out and have one community paramedic to go. It's as a needed type of a thing. There used to be a charge for it, but it was not cost effective at that time. Okay, so as of right now, it's as the doctor sees fit. Okay.
So, for you to come out, do you call your doctor, or do you?
There's,
I mean,
so you want to know how it is that I get to
how
get?
would you get sent
I get a referral. So what happens is social services and the nurse and the doctor and the providers and all they discuss the case, because that's what they do. They kind of are trying to figure out what the best care for you is. And if they decide, you know what, a community paramedic visit would be great for this patient, I get a referral on my computer. I get a notice that says, go see this person and here's what I'd like to have done. So the doctors are really the one that decides
So
what
you
I get to
probably
do.
have to call into your doctor and then they'll decide whether you
You
should come in or.
you got it. You basically that's really how it's been happening at this time. Is I've had patients, doctors who say my patient had an appointment at 3 o'clock and they're really not feeling well. Can you just go ahead and do a medical assessment on them and maybe get a lab draw to make sure that they're not having, or a culture to make sure they're not having an infection? And so they'll send me, but it doesn't happen a lot. And here's the other issue too: is can the community paramedic program also be abused like 911? It can be. In fact, I can't do medical reconciliations or medication reconciliations and sort people's medicines. I'd like to do that, but how many patients do I have? Doing that every week, it would be too much. And there's people that do that. Companies, Canute Nelson, that's one of their things. They come out, the nurse comes out and sorts your medicines. I can't be tied down to everybody's. Now I can do it when the doctor wants me to do it for specific drugs or medications, or maybe a change. Maybe you're taking medicine and the doctor doesn't want you to take it anymore because it's not good for you. He might send me out to say, hey, pull them from her sorter. I know what they look like, and I'll pull them for you. Okay? Those kind of things. But I can't do it every week. I wish I could. I really do.
So do you get sent out by, I mean, if we called 911 and then they decide that it's not an emergency, then do they send you?
No. When you call 911, it's an emergent. The ambulance will show up. That's part of the charter. That's part of the way they have to do. That's their duty to respond. Now, afterward, if they find out that it was probably a community paramedic type of a thing, they'll let me know, or they'll write it up on the report or mention it to the doctor at the ambulance in the emergency room.
Who comes if you have fallen and can't get up?
The ambulance. The ambulance
will
was
come.
absolutely. Absolutely. But here's the thing. What if this is a third or fourth time this week? Who gets sent out then? I'll call you and make an appointment. If this is the third or fourth time you've fallen, if it's the first time you fell, the ambulance shows up. You call 911, the hospital, the ambulance shows up, the police shows up. Because if they have to break into the house, they have the authority to do it, to break the door down and get in to help you, right? And so they come in, they put you in the ambulance, they take you to the hospital, the emergency department, they check you out. But this is the third or fourth or fifth time you've fallen. Then the doctor says, you know what, why don't we have Richie go figure out why she's falling? Maybe the rugs have to be taped down. Maybe your walker is not a good walker. Maybe there's just a lot of stuff in the house and you're tripping on it. And I'll write a little report and make some suggestions. Does that make sense? Okay, good. I'm getting the 30 minutes. So here's the mission. Here's what we really would like to do. Okay, we want to provide the best possible care for you in your home or in the facility. Some of the visits I do are actually in some of the nursing homes. I do lab draws there. The doctor can send me wherever they need me to check out. Their patients might be at Fair Oaks Lodge, they might be at the Meadows, and I'll go take care of them and do what they recommend. We're an extension of that personalized care that you are going to receive. Okay, we're just an extension. We serve as the eyes, the ears, and the voices of the provider. And here's what I mean. Maybe the doctor is really wants you to do certain things. I'll echo him a little bit. I'll back him up. Maybe you're not, some patients, sometimes they need to hear it from somebody else. And maybe I need to explain it a little bit better. Sometimes the doctor may not be able to explain it to you well, or you say, yeah, I get it, but maybe you didn't. We'll go over it and we'll learn together. Feedback. Maybe you're telling me that medication is really not working, or it's making me itchy, or it's not doing anything for me. I'll write it up. And it gives them feedback. And maybe next time, or the nurse will call you and say, hey, I just read a report that said that this isn't working for you. Tell me more about it. So you're getting another extra little visit without the time. And we provide communication. And the reason I put down the answer is always yes, that's really addressed to our providers and our nurses, because the answer is always yes. If it's not illegal or immoral or against the scope of practice of a paramedic, the answer is going to be yes. We'll figure something out to help you. That's really what we want to do. Now, many of you are familiar with the good book. Promise. That's a promise found there. No resident will say, I am sick. But until then, we have to do the best that we can to help you. And that's why we're here for you. For Astera Health and the Community Paramedicine, the EMS department, we want to help you to be as healthy as you can. It's not easy when you start having health issues, but we try to make it as easy and comfortable as possible. So, do you have any questions? Yes.
How far do you go out all the area? I mean, like
Absolutely. It used to be the previous management of my community paramedicine thought maybe just 30 miles around the hospital. But the way I look at it is those satellites out there in Otter Tail and and Heading, those are clinics too, part of Astera. So why not maybe 30 miles around those? So we go out. We'll do whatever. And again, the answer is always yes. We've had patients that needed something done in Fargo. If the doctor deems it necessary that I help somebody to do these things, we'll take care of it. Okay? You're welcome.
So are you educating more paramedics?
Are we educating more paramedics to do community paramedics? Absolutely. It used to be 1 semester, now they've changed it to 3 semesters. So it's kind of, which you have to incentivize, because paramedicine is already 3 to 4 semesters. It's already 1.5 to 2 years of class. And now you're going to ask them to take another 2 years of classes. So how do we incentivize it? Well, it takes a special person to want to do it. And so we want those who really want to do it. It's got to be a people person, because it is about the people anyways. Yes?
On that little report that you produced for the family or the person that you visited,
Yeah.
What are some of the most common things you check or find?
Absolutely. Thank you. So one of the, on this checklist that we have for safety, for injury prevention, one of the more common things that we find You'd be surprised how many people don't have smoke alarms. Or you see them hanging there, oh, it's making too much noise. Why? Well, it goes off when I burn my toast. Well, there's a reason why it's going off. Maybe either get a better toaster or, but they're there for a reason. There's that. We suggest carbon monoxide alarms because they go off before the smoke alarms go off. Smoke alarms, I don't know if you know how they work or not. They have a little light and they have a sensor, tiny little light and a sensor. And when enough smoke or moth dust or steam from the hot dogs you're cooking, when it blocks enough light, it sets it off. That's why it's irritating. That's why you shouldn't have it next to the bathroom when you open the door and the steam comes out and it sets them off. Or the hairspray, which I don't have a problem with, but the hairspray, the hairspray sets it off. Carbon monoxide alarm picks up parts per million of carbon monoxide. Okay? And so you'll see a number or it'll go off before the smoke alarm will go off. And it's a silent killer. So we recommend you have a carbon monoxide alarm. The other thing I can think of too is not a clear path. People are tripping left and right. Rugs aren't taped down. And all it takes is catching that lip of that rug. And a broken hip at our age, and I'm going to include myself in it, anything north of 40, you break a hip and it's not a fun thing. Okay? You don't want to fall and break anything at our age. Not as young as you think I am. Any other questions? Now just remember that we're here to help you. And we do the best that we can to help you stay healthy and live a relatively longer life. We really want to do that. So, okay?